Hi, this is Case of the Day. We're on our 99th case, and this is titled Rheumatoid Arthritis Associated Lung Nodules. So, this is a 61-year-old with rheumatoid arthritis, had mild dyspnea in 2013, so that's 12 years ago. And we actually pulled out all of these cases from 2013 to 2017 from our archives. We used to make DVDs and then keep them in a storage facility, and some of them still are present. And you can see here these cavitated and non-cavitated nodules. In fact, one of these has a feeding vessel sign, and there was a case report of this in patients with rheumatoid arthritis about 3 or 4 years ago. But anyway, the patient has had cavitated, non-cavitated nodules. And so, what are your thoughts? I mean, clearly, these are different. This was ILD with honeycombing with a fungal ball, and I saw that, and I talked about it again as case 93. But this patient doesn't even have ILD. It's just multiple cavitated, non-cavitated nodules. And so we would consider infection, either fungal TB, METS, multifocal primary lymphoma, or associated vasculitis, or rheumatoid nodules. And we used to use the term necrobiotic nodules in the past, but the idea would be just rheumatoid nodules. I did a biopsy at the time, and it just showed granulomatous foci. And the patient, the pathologist said it could be TB, but microbiology was negative, so the patient wasn't put on anti-TB treatment, was observed. Now, I'm not sure whether the patient was given any other treatment or not, but then some of the lesions remained the same, some increased, as you see here, about 5 months later. She had multiple scans throughout the years, and then came back day before for one more scan, and I read it this morning because we wanted to remove all the old scans. And so some of the lesions have changed character. This one has become a little more confluent. This one has changed itself. And if you look at what we had in 2013 and now 12 years later, there is a change in the pattern. And if I just put all of them together, let's just look at this lesion in the right lower lobe. It was a small nodule. 12 years later, it's increased in size. Whereas this nodule reduced in size and has almost completely disappeared. Whereas this lesion in the posterior segment of the left upper lobe increased in size up to 2014, then reduced and is now just an opacity. So there's a lot of waxing and waning, but the patient has become symptomatic again. So there is a little more waxing than waning happening at this point in time. But this is over 12 years. And sometimes it astonishes me how, if we preserve the soft copy images, we have so much data going back that we can look at. So I just looked at some of the literature, and there is this one article that summarizes a bunch of things. It's out from Turkey, and it's very recent. And they say that prevalence of lung nodules in patients with RA may be up to 32%. But this is also they've quoted another paper for this. In their series, cavitary transformation, though unusual, is seen in about 9% of such nodules. If there is cavitary transformation, that's strongly associated with seropositivity, both anti-CCP and RA factor. Those who have cavitary transformation may have larger nodules, and they talk of waxing and waning. And there are a whole bunch of papers that say that there's possibly some association with leflunomide use. Our patient is taking that, and so maybe there is a case for changing the drug. But I don't have the entire history in great detail, so it'll be up to the rheumatologist and pulmonologist to tease all this out and then figure out if the patient just needs to be observed or needs any active treatment. But the point here is that we do need to distinguish them from infection, vasculitis, malignancy, and in our country often a biopsy is needed because of the strong prevalence of tuberculosis in the background. And I guess in today's day and age, sometimes we may land up doing a PET CT as well. So, in summary, when we see multiple nodules in a patient with RA, while rheumatoid arthritis associated nodules or rheumatoid nodules are not uncommon, we do need to rule out infection, tumor, associated vasculitis before labeling them as rheumatoid nodules. That's the AI seminar next month, my WhatsApp channel. Thank you for viewing this.